Thank you so much for your time today, Dr. Michael. Could you just start by giving us a bit of a background about who you are, training?
Yeah, sure. Thank you very much for the invitation, Emily. Nice to see you again. My name is Dr Michael McLaughlin. I'm a consultant intensivist and anaesthesiologist, and I'm the director of the intensive care unit at American Hospital, Dubai. So I moved here in January 2021 from Scotland, where I spent all of my time working. So I studied in the University of Dundee, and then moved down to Glasgow, where I did the majority of my anaesthesia ICU training, then worked as a consultant at Glasgow Royal Infirmary for 5 years before moving here.
How was your experience relocating to work at the American Hospital in Dubai?
So there was definitely a very interesting time so I came here January 2021, so we just really got through the first wave of COVID, so the world was a very different place when it was time to move across. So the transition was fairly easy in terms of getting everything sorted and getting across, because no one was really going or flying anywhere. I remember going to Glasgow Airport, and it was me and my family sitting, everything was closed, and we were sitting almost in an empty airport waiting to fly to Dubai. After I got to American Hospital, very warm welcome, very well looked after. We were put into an apartment until we found our feet, which was really very helpful. And then there was really no time to stop, because the second wave hit almost within the week that I arrived. And so it was full throttle from there. There was no time to stop, and it was like that for months. And so by the time we kind of got through the next wave, you know, my family had already settled in because it had been a few months. And then probably that delayed my settling, I think, because then it was getting used to, you know, living in Dubai and not just working here.
Yeah, so you was like literally thrown into the deep end. Yeah. And how did your colleagues and the management support you at the American Hospital during that time?
Yeah, so the ICU department was growing at that time, and we had to, because like our ICU even back in Glasgow, we had to grow to expand, to take the patients that were coming through the door. But I think, you know, we have a very good senior team. You know, Mr. Sharif Bashar is a fantastic CEO, Tariq Dafan, Dr. Tariq Dafan, an excellent chief medical officer, and I think they threw every resource possible at that so that we could operate as a COVID hospital, and not every hospital did that within the UAE. But we took patients from everywhere. We helped the government sector, and we were a very, very busy unit, and ultimately we had very good outcomes as well. And I think that's a testament to just how well organised that was.
Absolutely. And, and I think that was like one of the really positive things about that situation. It just showed how resilient and how strong the UAE healthcare system actually is, and the country, in fact. Because I was here in COVID, and I was really impressed with how the leadership, the government, the hospitals, everyone dealt with that situation.
There was a very good documentary as well, COVID-19, that was done by the Discovery Channel, which American Hospital were part of, and that was very great to see. Very emotional, but that also was part of moving here to Dubai. One of the first things that I see is a camera crew following us around the hospital. You don't get that in Glasgow, really. So, but it was very interesting to kind of take a step back from that and see that very, very emotional kind of documentary. But again, it comes back to your point in terms of, you know, the resilience and how Dubai and the UAE, you know, they shifted people's jobs across some other sectors to try and maintain things. It was just really, really incredible to watch that.
Really inspiring. Yeah, so because as we have over 200, I think we have over 200 nationalities here in the UAE. So what would you say are the challenges and the benefits of working with international colleagues from all over the world?
To be honest, I think the challenge was probably more for them, understanding my Scottish accent for the first, it's taken 4 years, and I think now they're finally getting used to it. But I think, you know, it's probably more benefits, actually. If really, it's great to have international colleagues, because we all have one primary goal. I have a fantastic team. Predominantly, they're all US trained pulmonologists, intensivists, but they're from all over the US. They're, I think there's Oklahoma, Boston, Chicago, Florida. So really, really, you know, extensive training. But the core training for all of us is pretty much the same. And because we do have this primary goal, it's been very, you know, great to work with these guys. I learn from them, they learn from me. So if anything, that collaborative approach internationally, I think, helps patients, and we use guidance from, the NHS back home. We use guidance from the US, and we kind of amalgamate that, along with the DHA policies and regulations in order to do really what's best internationally for patients.
That's a really good point, actually. Yeah, that's one of the questions that comes up from other doctors, who are interested to work here. They ask about what system do they follow here in the UAE, and because it's so dynamic, so many different people from all over the world. So so is it like the DHA has some rules and then it's sort of influenced by different systems?
The DHA will have their policies and regulations to follow, and that, but again, that will be based on international guidance as well. World Health Organization, or American Heart Association, the American Society of Anaesthetists. But there are guidance that also come from, NICE guidelines from the UK, and I think a lot of that is amalgamated into this system in order to deal with the patient population that we have, because I guess every patient population, every demographic is slightly different. And so, but I think there's a real mix of evidence-based practice that goes on from all over the world, not just the US and the UK. There's good evidence from other places in Europe, Australia. So I
think that's the most important thing, isn't it? It's that it's all evidence based. So. And so how is the organ donation program, it's Hayat, and how that's developed, and what your role and your team's role at the American hospital has been with that program?
The Hayat program has been an extraordinary development. So the law changed in Dubai in 2016 for donation and for what we call death by neurological criteria, so brain death. So that was 2016. The program then began in 2017 when they started doing transplantation. And the Hayat program is effectively a platform for the control and regulation of donation and transplantation processes. So my last look in the system was about 32,000 registered donors now within the UAE in a short period of time. There's been about 1,000 organs transplanted, give or take, from about 255 donors, of which 150 odd were done last year in 2024. So that is really, an accelerated process to the point where the UAE has been used as a case study for several other countries, looking at how you can go from zero to where we are now in terms of donors per million population. So there's been a huge growth and development in that area, which is really important for patients here in the UAE and in the GCC, because organs are shared beyond just Dubai. In terms of my role, so I guess there's a more local role within the hospital, and then external to that. So part of what I did after COVID and after everything settled down was to build what we call the organ donation unit within the hospital, and that's really about being able to identify potential donors, particularly within my field in the ICU. If there are no donors, there are no transplantations. So we need to identify them. We need to identify the patients who would potentially go on to become donors. And that really facilitates early communication with families, early communication with donation teams. And that took quite a lot of work to build up that behavioural change within the hospital, and also in terms of the policies and the processes that we have to go through for that. And then also how we protect the organs after. So if someone is diagnosed as being, as death by neurological criteria, as being brain dead, then there's a process to protect organs so that they don't get damaged any further when the brain is no longer working, and the body's imbalance can cause issues to the organs. It's what we do in ICU. We provide organ support, but this is just really another level for another purpose. And then external to that, so I have a good relationship with the committee here. I've travelled with them. I've been to Europe. I think it was time is flying very fast, but a couple of years ago now we went to Athens, Zagreb, Madrid, Barcelona to see best practice donation sites. So I travelled with that team and we went around all of these hospitals, which was really fascinating to see. And then we bring all of that information back and trying to adopt it into our own policies. And I also provide, help when needed for second opinions for brain death, or for discussions about consent for the donation process.
Wow. And is that just within the American hospital, or do you also collaborate with other hospitals in the region?
Yeah, so the collaboration is kind of done under the Ministry of Health, MOHAP, and the DHA, and then the Committee for Organ Donation and Transplantation. But our hospital has been very, very open, very, very supportive of this process, and so they allow me to go to other hospitals when I'm asked by the committee to give second opinions or to speak to families, and they really have been very supportive. They also provided training for, not just for me in terms of the advanced diploma for donation transplantation, but for our nursing staff who are part of the team as well.
Wow.
They provided that fairly, extensive course, which is normally carried out in Barcelona.
You must have to work quite closely with like that. Like if there's a patient in another hospital.
Yeah, so it normally comes from the committee. It comes from the
so it comes
from the committee down,
right,
rather than hospital to hospital. So if you look at it as a kind of overarching process, then the committee will be the team that determines, can you go and see X, Y, Z? Because sometimes they're British and they like to send someone who understands the ethical differences, religious, cultural differences. It's quite important to try and be as close to the patient and the patient's family. It's a very difficult time. You can imagine very traumatic, very difficult conversations to have, very sensitive.
Difficult, uncomfortable conversations. And that's amazing what you've achieved, yourself and the hospital. That progress is just phenomenal.
I think with the hospital support, you're right. I think we have achieved a lot in that period of time. We have gone from nothing at all to now having our own internal tracker for potential donors. We have an automated process which will pick up certain ICD-10 codes and email myself and the team every morning that we may have potential donors to see and to go and look at and to have a discussion. But it's a work in progress, and I think that's the thing. It's not just that something's being done and left. It's that almost on a weekly or monthly basis, there are changes, there are evolutions, there are things just continue to move forward, and we learn from little parts. Maybe the form wasn't right from before, maybe there was one word out of place. We learn, we change, we move, and it's just constantly adapting. Yeah,
exactly. And do you ever get to see or hear about the stories of the patients when they survive?
So in the UK, they had an amazing system. It's a very well established system in the UK, and you would always get a letter from the donation coordinator afterwards, and it would say, thank you for your help with this donation. The liver has gone to Mr. such and such. He was on the waiting list. And these are some of the most incredible, emotive letters I've ever. I think I keep them all. I've got them in a folder somewhere. It's something that I've brought up here, hoping that will start. But certainly, we speak to the team to try and see what happened. But it's a bit more, confidentiality, and there's some differences here that mean that legally you can't really do that. But sometimes we do hear about it.
Yeah, because that would probably, like if you saw those case studies and you saw like the difference it makes to people's lives and the families, it would probably encourage other people to be involved with such decisions.
Definitely. I think there's a lot of publicity about this as well. There was a young boy called Vigo, whose mother now speaks. She's amazing. So he had an accident and donated his organs, and his mother now speaks about that very, very candidly, and she has been a big driver for this movement, and she is really, really incredible. I've heard her speak, and I've met her, and she's wonderful, and she's doing a really good job. And it comes back to that point, it's turning this really, really tragic event into something, this gift that's really incredible for multiple people. That young man saved 4 or 5 lives, and his death is a tragedy, but his mother, has really transformed that as best she can into this incredible positive movement for donation, and really, really incredible.
And how was your experience working with Allocation Assist?
Yeah, it was great, really, really straightforward. I mean, you've evolved so much since the time that I contacted you and used you, and over 4 years ago. In fact, it would be almost 5 years ago since the first contact, and at that point it was about licensing, and it was just a breeze. And I probably get 2 messages a week in my LinkedIn inbox just saying, what do you think about Allocation Assist, and are they a real company, and can I trust them? And I've always got positive things to say about it. I think you made the process just really, really smooth at a time when, if you're thinking of moving, that you've got a lot of stress, a lot of turmoil, and it was done. The license was there, and then we could move on to try and focus on getting a job.
Yeah. Thank you so much, Michael.
You're welcome.